First pharmacological class that will be talked about are inhaled anesthetics. The prototypes are volatile liquids, called isoflurane, trade name fluorine, and anesthetic gases, nitrous oxide, also called blue cylinder, and laughing gas. The action of inhaled anesthetics is that they increase the inhibitory effects of the neurotransmitter GABA, thus decreasing CNS responsiveness and producing severe CNS depression. Therefore, by inhibiting GABA, patients become sleepy. Indications for use: inhaled anesthetics are used during the induction and maintenance phases of anesthesia. They can be used for all ages. Isoflurane produces general anesthesia by itself, but nitrous oxide is less potent and it cannot do that. The use of inhaled anesthetics is contraindicated in patients that have a family history of malignant hyperthermia, a history of severe postoperative nausea and vomiting. You need to use caution in patients that have existing renal and hepatic impairment because these anesthetics reduce blood flow to those organs and can cause temporary dysfunction that can be exaggerated when used. With any drug, there are side effects that we need to be aware of. What separates nitrous oxide from isoflurane is that it can cause sinus problems from the pressure of the gas being inhaled, but the main side effects that we need to focus on are hypotension, tachycardia, respiratory depression. Inhaled anesthetics can cause airway irritation that can lead to wheezing, nausea, vomiting, especially PONV, so post-operative nausea, vomiting, and the biggest adverse effect that we need to be aware of is malignant hyperthermia. So malignant hyperthermia is a genetic disorder. It is passed down in families, so we will be assessing if they have a family history of this disease, so proper precautions can be put into place. Malignant hyperthermia is caused by volatile liquids, so it is caused by isoflurane. As nurses in the OR room, our primary assessments that we're looking for MH are an increase in end-tidal carbon dioxide volume and a decrease in oxygen saturation, and these will be very quick, and we're also looking for tachycardia. There are several other symptoms, such as elevated temperature, body rigidity, respiratory and metabolic acidosis, skin mottling, diaphoresis, hyperkalemia, and myoglobinuria. Also, as nurses, we need to make sure that we are assessing when we give these medications. So the big things to assess with inhaled anesthetics are just monitoring those side effects. So if they are too hypotensive, we need to assess their blood pressure, quality of their breathing. We're monitoring their oxygen saturation with the pulse ox, maintaining a stable body temperature. We're assessing for nausea and vomiting, and putting interventions into place to help them with that. We are going to teach them about the risks of an inhaled anesthetic, things that we can avoid. If they have a history of PONV, we can give them intravenous anesthesia. If they have a family history of malignant hyperthermia, we will not be giving them isoflurane. We will be giving them nitrous oxide in conjunction with other medications to get them into a state of balanced anesthesia. We're going to encourage smoking cessation. We're going to discontinue other medications that could interact with the anesthesia. No alcohol, NPO status, all those good things that are associated with surgery. All right, and then a little story to help with memorizing inhaled anesthetics. So Floan is absolutely volatile. I don't like that, actually. Flo-Ann is a mean, mean lady. She is extremely volatile and comes across as highly potent to all ages. She works at a diner in the sleepy town of Gaba, and when she's cooking, things are hot in the kitchen. Flo-Ann is a mean, mean lady. She is highly volatile and potent to all ages. She works at a diner in the sleepy town of Gaba. When she's in the kitchen, things are hot, fast, and rigid. Her food is so bad it makes people nauseous and can make them vomit. All right, breaking that down, Flo-Ann is isoflurane. She's mean, and volatile and potent. So that's just essentially breaking down the prototype in Sleepy Town of GABA. That is an inhibitory neurotransmitter that we're working with. When she's cooking in the kitchen, things are hot, fast, and rigid. That is malignant hyperthermia, our number one adverse effect that we are assessing for. So malignant hyperthermia increases all of your vital signs. You have an extremely elevated temperature. But the elevated temperature is a late sign. And then you have a lot of muscle rigidity with MH. And then this drug also induces post-operative nausea and vomiting, so it can make her customers nauseous.